Hello, this is Lindsay Fuchs, and this is my presentation on cholecystitis. First, we're going to start off with our subjective assessment. We're going to figure out what their patient's chief complaint is and why they're here in the clinic. Next, we're going to address their past medical history. We want to know about any past acute or chronic GI conditions that the patient may have experienced or been diagnosed with. Is this going to help with differentiating what is currently going on with the patient? Next, we're going to want to know about any past surgical histories of abdominal surgeries, such as appendectomies, gastric bypasses, also obese surgeries, such as C-sections or hysterectomies. Next, we're going to ask them about their family history, see if there's some GI conditions in their family. As we know, GI conditions can be genetic, so it's important that we know about their family history of GI conditions. Also, it's important to ask about GI cancers. One of them that really sticks out is colon cancer. After that, we're going to do our review of systems, where we want to ask GI-focused questions to gather more information about what the patient is currently experiencing to help us figure out labs or diagnostics that may need to be ordered. It's important that if a patient does state something is happening with them, that we look for more information regarding that. Therefore, we use old carts to get more additional information regarding the symptoms. So if someone comes in with diarrhea, we want to know when it started, what makes it worse, anything makes it better, so we can really get more evidence and more data. Some normal GI assessment findings. Upon inspection, the abdomen should be symmetrical, same skin color and characteristics as the rest of the body. There should be no lesions or rashes. The abdomen should be flat, smooth, and even movement with respirations. There may be hair and striae. And osculating bowel sounds. There should be normal active in all quadrants, about 5 to 35 sounds a minute. There should be no bruits in the aorta, renal arteries, or iliac arteries, and or femoral arteries. Percussing company should be expected, except for dullness, would be found over the liver, spleen, or full bladder if the patient has a full bladder. Upon palpitation, there should be no pain, no tenderness, no masses, or no hardened areas. First year patients, we're going to ask them if they're having any abdominal issues, any abdominal pain, any diarrhea, any constipation, anything that should be aware of. Currently, the patient is not. Next, after that, we're going to inspect to make sure this abdomen looks good, symmetrical, no rashes, no lesions, nothing like that. Also, that it's the same color as the rest of the body. After that, we're going to do some auscultation of the quadrants. So we're going to listen to the left, right lower quadrant, right upper quadrant, making sure that we're hearing about 5 to 35 sounds per minute. After that, we're going to do some percussing. Should be sounding in tone and timpani, especially except for over the liver. Dull. It's going to also very powerful bladder at the time as well. Next, we're going to do some palpitation. If you have any discomfort or pain, please let me know. We're going to start with some light palpitation. Passes. Lastly, we're going to do some deep palpitation. When we first see our patients with abnormal gastrointestinal findings, we are going to find with cholecystitis. Patients with cholecystitis will often come in with complaints of tenderness in the right upper pain can also radiate to the shoulder or the scapula of the right side. Patient will have guarding of the abdomen and sometimes experience rebound pain. Additionally, the patients will have a distension of the abdomen and complaints of bloating. With these patients, there are no changes in bowel sounds. Patients will also have normal tone when concussing. When palpating patients with cholecystitis, there will be a positive Murphy sign. The Murphy sign is a pressure over the liver. We'll have the patient take a deep breath, and the patient will experience pain in doing so. The gallbladder in some patients may, if severe enough, with cholecystitis may have a palpable gallbladder. This is also known as Forbuer's sign. Other complaints the patient may have or experience are fever, tachycardia, nausea or vomiting, loose and light colored bowel movements, and food intolerances such as eating greasy, spicy foods. Differential diagnoses that we should be thinking about when thinking also cholecystitis is appendicitis, if the patient has not had their appendix removed, or gallstones. Another one that is also important to look at is GERD. And then this is my references, and thank you for listening.